Hello, my name is Mary Lou Grunert and I'll be your nurse today. I'll be assessing your chest and your respiratory system.
Okay.
So what is your name?
HM.
And what is your age and date of birth?
I'm 60 years old, April 21st, 1954.
Okay, and your race?
A Caucasian.
And your profession?
I'm a legal secretary.
Okay, so you're not exposed to chemicals or any poisonous air?
Not that I know of. It's just an office building.
Okay. Do you have any allergies?
Penicillin.
Okay, what happens with penicillin?
I almost passed out when I was 12 years old, so I avoid it.
Okay, that's a good reason. Do you have any respiratory problems, asthma, difficulty breathing?
No.
You never had any
Never
of
had
those
any
problems.
problem.
Okay. Have you had any illness lately?
No.
Okay. How about your family? Do you have history, anyone in the family that had the history of cancer, respiratory problems, tuberculosis?
Not that I know of. Nothing to do with the respiratory system.
Okay, very good. And do you go to your doctor routinely?
I go once a year for my annual exam.
Okay, and do you smoke?
I used to smoke. I just quit a month ago.
That's excellent. And how long did you smoke? For how long?
On and off for most of my life.
Okay, so that's great news that you have stopped smoking.
I'm happy.
All right, okay. Okay, so exercising. Do you exercise?
On and off. Right now I'm not because it's very cold. We have a gym at my office and I try to go twice a week. Sometimes.
Okay.
But as soon as it gets warmer, and I have actually exercise equipment in the basement that I could use, but
Perfect.
sometimes
I hope that will happen sometime soon. Okay. So then we can start our examination, okay? First I'm just going to do inspection, and then I'll do palpation and percussion and auscultation, okay? So breathe normally, and you can open your arms, and I can see that your body is symmetric as you breathe. I don't hear any abnormal respiratory sounds. And then I'm going to go ahead, I'm going to start inspecting your chest, okay? For any masses, crepitus, anything abnormal, okay? Check your trachea. Okay. Your suprasternal notch. Your angle of Lewis. The costal angle. And the T1, C7, they all seem okay. And I'm going to inspect laterally. Okay, palpate. Okay, everything looks normal on the palpation. Now I'm going to ask you, I'm going to palpate one more time, but I'm going to ask you that you say 99 so I can listen for the tactile fermates. Okay? 99 and
99.
Keep going.
99.
Keep going.
99. 99.
Okay, and then I'll go to the posterior and
99. 99. 99. 99.
okay. And I did feel the fermates, but was bilaterally equal. So it was very symmetric. Now I'm going to look for your chest expansion. So I'm going to put my fingers at your xiphoid process, and I'm going to ask you that you breathe deeply. Okay, and I can see the expansion. Do it one more time. Okay, and I can do it in the back by the tense rib. And you can do a very good, great expansion. Very, very good. Excellent. Okay, so now I'm going to do percussion of your thorax for resonance, for sound. Okay? So I'm going to start here. I'll do posteriorly, which is much easier because of the breast tissue. Okay, so the resonance is good. It's symmetric bilaterally, and I'm also going to do a diaphragmatic excursion. I'm going to do that in the back, in your posterior aspect of your chest. And I'm going to ask that you breathe deeply and hold it, okay? And then I'll be doing this percussion, and I'll tell you when to breathe normally. Okay?
Yeah.
Okay. So at this point, I would write a line here because there is no more resonance. There's only dullness. So that's the end of your breathing. Okay? So I'm going to put a line here, and then I'm going to ask you, breathe normally now.
Mm-hmm.
And now you're going to breathe deeply and exhale deeply and hold it. And I'm going to do it again, okay? So inhale deeply, exhale, and hold. Okay, so at this point is the dullness area, and I'm going to measure from the first line to the second line, and this measurement should be between 3 centimeters to 6 centimeters. Okay? So now all I have to do is the auscultation. Okay, so I'm going to auscultate your body for any abnormal sounds. Okay, I'm actually start very high up and breathe slow and deep. Nice and deep. Okay, you can lift your arms, and I'm going to hear under. Okay. And both arms, sorry. Okay, now I'm going to do the posterior. Nice and deep. Okay, so I don't hear any wheezing, any crackles, any ronchi. It sounds like normal breath sounds. And that concludes our examination. Thank you very much.
You're welcome.